Hello, this video is presented by the Children's Minnesota Rehab Pediatric Pelvic Health Program, and the topic of this video today is the pelvic floor system.
The pelvic floor muscle system works very closely with our GI and urinary systems. Here is a model of a body, and this is where your pelvis is located. It's what connects the top part of our body to the bottom part of our body. Now we can take a closer look at a model of the pelvis. It's made of bone, and it sits in your body like this. Your bladder and rectum also sit inside of your pelvis. The bladder, which stores pee, sits in the front of your body, and the rectum, which stores poo, sits in the back of your body like this. Your pelvic floor muscles attach to these bones and help to support the inside contents like a hammock. There are 5 layers of pelvic floor muscles that sit in the pelvis. They are oriented from bottom to top, and different layers of these muscles help the bladder and rectum do their jobs in different ways. It's important to know that we have control over some of these pelvic floor muscles and can squeeze and relax as we want to. These are the muscles that are closest to the bottom level. There are other pelvic floor muscles that we do not have control over, and our nervous system helps to control these muscles to squeeze and relax. These are some of the higher or deeper muscle layers. All of the pelvic floor muscles and nerves need to work together with the urinary and GI systems for a body to function as it should.
Now let's look closer at the pelvic floor muscles and how they work with the bladder and the rectum. First, let's talk about the bladder. Now remember, your bladder is like a balloon and it holds the urine until the urine or pee is ready to empty from the body. And the urine leaves the body by the urethra, which passes through the pelvic floor, like this. Brianna's hands and fingers represent the pelvic floor muscles, and you can see how important the pelvic floor muscles are to control the pee staying in when it needs to and allowing the pee to empty when it needs to. The pelvic floor muscles need to be strong and active to hold the pee in, and the pelvic floor muscles need to be relaxed to allow the pee to empty. Our pelvic floor muscles need to be good at doing both in order to do their job. Next, let's talk about the rectum. Now remember, the rectum is part of the GI system where the poo passes through right before emptying from the body. The bottom part of the rectum passes through the pelvic floor muscles, just like the urethra passes through the pelvic floor muscles. Again, because it passes through the pelvic floor muscles, those muscles are an important part of keeping the poo in when we want and emptying the poo when we want. The pelvic floor muscles need to be strong and active to hold the poo in, and the pelvic floor muscles need to be relaxed and know how to push the poo out in order to empty. Our pelvic floor muscles need to be good at doing both in order to function well.
Within the 5 layers of muscle, one specific pelvic floor muscle is very important for efficient pooping. It's called the puborectalis muscle and is found in layer 3. This muscle slings around the rectum like this. When our bodies are active or standing, this muscle pulls the rectum tight, giving you extra protection to keep the poop in your body while you're busy. When it's time to poop, we want to relax this muscle in order to empty. One way to relax this muscle is to get in the toileting position. The best toileting position is to sit in a squat with your feet flat and supported and your knees higher than your hips. One of the reasons your posture on the toilet is so important is related to your puborectalis muscle. This position allows that muscle to relax, which allows the rectum to open and angle down. This allows for easy and complete emptying. So use your step stool. It's so much easier for your body to poo when you're in the right position.
Your pelvic floor muscles are an amazing part of your body. In addition to helping you go pee and poo, they are an important part of your core muscles and your core pressure system. They work with your stomach, back, breathing, and speaking muscles to help you do all sorts of things like run, jump, sing, and laugh, and have healthy pees and poos. Here's a picture of your pressure system. At the bottom, you have your pelvic floor muscles. In the middle, you have your diaphragm, which helps you to breathe. This muscle is moving up and down all day and all night. And then you have your glottis, which is located between your vocal folds and opens and closes to allow you to speak. In the front of the pressure system, you have your belly muscles. And on the back of your system, you have your back muscles that support you to move. Managing your pressure system is an important part of your bowel and bladder therapy. Your therapist will help to investigate how your system is working and will teach you techniques tailored to meet your specific goals.
Thank you for watching today. Remember, you and your therapist are a team, and it's important that you work together to meet your goals. Don't forget your step stool.